today we're going to demonstrate car transfers. The first car transfer we're going to demonstrate is in a regular car, sedan type of vehicle. Back seat transfer, we're going to assume this patient has a joint replacement or an ankle surgery, so the lower extremity. Getting in on this side means that this patient has a right total joint replacement or an ankle surgery, because we want to have the surgical leg closest to the back seat so that they can use their good leg on the floor. Okay, I'm going to show you how to use a garbage bag to make it easier for patients to slide, especially for patients who have short arms or have weakness in their arms, or have maybe difficulty because their arms are short reaching to the seat. It'll help them slide across. So first, take your garbage bag, start it at the seat and have it go back. If the patient has a gait belt on, you can use the gait belt. If they're having a struggle sliding across, you can come around the back side, and I'll show you that to help them scoot a little bit. So I highly recommend taking a gait belt with you when you do a transfer, because it could come in handy. So I'm just going to leave it on the patient. I'm going to show you how to try to use the door and the car. The patient might not have to use their walker to get up to the car. Make sure that the wheelchair, of course, is locked. You can cue them. You're going to stand up and you can use the car door, the car frame, the top, any of that to help you to stabilize. But I want you to push up from the chair. You're going to ask them to reach back until they're sitting. Once they're sitting, move this wheelchair out of the way. So you're going to hold their right leg, and you can tell them as soon as you get your left leg in, that can help scoot. They can use their arms on whatever part of the car to scoot in and back. Okay? This patient has that console right in the way, so I might tell that person, come forward a little bit. I'm just making sure their foot will be in there so they can get their foot on the floor here. Or they could go back far enough to get their foot back there if that's uncomfortable. Not everybody's going to have that console right there. That is kind of uncomfortable. The patient could, on this car, could have both feet out if they can tolerate that for their back. We tell patients to bring a pillow for their back. Their family should have a pillow there. But you can see how the garbage bag helped her slide across the back seat. It made it easier for her. Sometimes patients can't get their hands to the actual seat to scoot, and they can use all this part of the car to help them with their arms to help slide. So I'm going to have Deanne come back out, and I'm going to show you somebody who may be really struggling with getting in. So if they have another person here, like their family, you could ask their family to hold the leg while you go around the back. Take a hold of the belt and help them to slide. Slide easily down there. Of course, this door would be shut after you're done to make sure they're safe, but that belt can really help the slide, okay? So you're always going to have another person with you, but that person might not be helpful to you because they're too weak and they can't do that. So if it's just you by yourself, if you have the gait belt, I guess if you had two gait belts, the person could use the gait belt around this foot to kind of help their own foot in. You want to try that, Dee? Yeah. While you go around and help them slide. These are just for the problem patients. You can make this gait belt really long or really short depending on their leg, and they may be able to hold this while you're helping them scoot from the other side. Okay? Unfortunately, that is really a weird car. That wouldn't be the most comfortable way to go for a patient. Well, I haven't seen many this bad. I'm not sure. I don't think that consult moves up, but we had to use this car for the demonstration because we didn't have anybody else that had a sedan. So I'm sure when you get down to transfer patients, there's going to be unique car situations. If they live more than a half an hour away, they need to ride like this in the back seat, so their legs elevated for the ride home. If they're a knee replacement, a hip replacement, a hip scope, or an ankle surgery, this is going to be best for them so their leg isn't swollen when they get home from having it down for too long. The physical therapist will discuss this with them before they leave and make sure they have the proper vehicle. If they do not have a vehicle that this will work, the therapists are going to problem solve with them. They may have to ride with their foot on the floor in the front seat or in the back seat if we don't have any other options, which is unfortunate. So we're going to go over a transfer to get the patient into the car in the front seat and the back seat. So you would decide based on leg room, because we prefer patients to be in the back seat. They're safer back there because their legs aren't under the dashboard. Sorry about the okay. Ambulance. So sometimes we can do in the back seat. There's enough leg room. For somebody as short as me, it'd be fine. But if a person was super tall, they may have more leg room in the front seat. Okay, so Deanne, I'm gonna have you come back out. You can see how the garbage bag is helping Dee slide. I think it's helpful, Dee?
Yes.
Okay.
I'm just get up.
So she's gonna come back out. So same patient. This is her leg, her surgery leg. So she's gonna have that down, and then she's gonna sit down. Wow.
Yeah.
So before she sits down, bring the car up as far as it will go. And maybe even the back seat part. So this is as far as that goes. So you'd have to look at that leg room and see if that's even possible for this patient. Because remember, they have a joint replacement. And this isn't gonna work. I don't think that's gonna work for anybody except for maybe a spine patient. Spines don't have their legs elevated. They ride with their feet on the floor. So if they were a shorter person, so I'm gonna do be the patient because I'm small, and Deanne doesn't really even have enough leg room. So you got to look at the patient. So Dee, let's switch.
Okay.
So I'm a spine patient. I'm the only person that could possibly ride in this back seat. Would be a shorter person who has, a spine, okay, spine surgery or shoulder. So they'd sit. If they're in pain, tell them to scoot back as you help them bring the legs in. You can help lift them in. Deanne, you want to show them that? It's hard because she's going to kind of be in front of me.
Okay. So I'm gonna lift her legs in, making sure she doesn't twist.
So now I have leg room here, but if I could probably be 4 or 5 inches taller than me, but not much more. And I wouldn't be comfortable back here. Coming out, you can tell them when their family has to get them out, they're gonna have to turn, and their family may have to help them lift their legs out, or they may be able to lift their legs out. If they can lift their own leg in, great, but you may have to help them. So we'll do it for the front seat. See how far the seat goes back. Looks like there's going to be a lot of leg room here. That's a lot of leg room. Okay, so a lot of taller people, this is going to be the best option. I did recline the back of the seat. You want to do that first because this gives the patient more room to move. You can always bring it up if they're uncomfortable, but this gives them more space, okay? So Deanne's taller than me, so she stood up. She could be a joint replacement that doesn't have back seat access. She could be a spine patient. You could use the belt if you need to for this patient, but they may not need it. The belt is mainly for the back seat, helping them slide, okay? So now Deanne's gonna use her arms. You can tell them, help start scooting, and I'm gonna help your legs in, okay? So they're definitely gonna need some assistance there because it's gonna be sore. They have to make this turn, and then the back seat, they slide straight in, so it's gonna be more tender to them. So try to have them slow down a little bit so, you know, you can give instructions. Now she's in here, she's got lots of leg room. You could ask her, do you need to come forward with your back? And we could bring that forward. She's got, at least she has some leg room there, okay? You can tell, you know, we will already have explained how to get them out because the family is gonna be getting them out at home. But if they need help, and then their family will be there with their walker. Get them out. So these are car transfers, back seat, leg elevated for a limb surgery, back or front seat for a spine, and that depends on leg room, and a shoulder also could be in front or back. Okay? So that's it on transfers in a car. We're gonna do now a SUV.